Welcome to the Happy Bones, Happy Life podcast. I'm Margie Bissinger, a physical therapist and integrative health coach, and I am your host and guide on our journey to discover the keys to stronger bones, more happiness, and the secrets to live your best life ever. From nutrition to stress, from exercise to happiness, you will gain revolutionary insights from our leading experts. It is time for you to discover the health and happiness you deserve. Hey, Margie here. Did you know that there's one nerve that plays a major role in digestion, inflammation, and relaxation? All things that can have a big impact on our bones and overall health. Well, that nerve is the vagus nerve, and we're going to delve deep into that today with our special guest, Dr. Navaz Habib. And Dr. Habib is the founder of Health Upgraded, a functional medicine and health optimization clinic in Toronto, Canada, where he works with high-performing professionals, athletes, and entrepreneurs to dig a little deeper and find the answers to what is holding back their health. Dr. Habib's book, Activate Your Vagus Nerve, is a simple-to-follow guide to help you identify and address a major missing piece in our health. And by activating the vagus nerve, not only are you helping your bones and overall health, but you can optimize your productivity, focus, and energy levels. And don't we all want to experience the effects of upgraded health? So in today's episode, we really talk about what the vagus nerve is, what its functions, how can we find out, if our vagus nerve is functioning optimally. And my favorite part is Dr. Habib gives us some really easy tips and tools that we can use to really optimize the function of our vagus nerve for better health. So stay tuned. Welcome, Dr. Habib, and I think I'll refer to you as Navaz from now on. But I'm so really thrilled to have you here. You're bringing such a great piece to our puzzle. I'm really excited about talking about the vagus nerve because it's something that is not, it's not something people go to the doctor, oh, how's my vagus nerve, or even that they know what are the implications. So I'm just really thrilled that you're here and sharing this amazing information with all of us. So thanks so much.
My absolute pleasure. Thank you so much for having me and for sharing my work with everybody.
Oh, I'm just thrilled. Anyway, let's just get started. Before we even go into anything, just tell people, what is this vagus nerve that we're spending this entire episode talking about?
Absolutely. It oftentimes when people see this topic, they're like, what is this? What are we talking about? And yet it turns out to be one of the most important nerves in the entirety of the body and in creating an absolutely healthy and recovery, a body that's able to recover from stressors that come up on a daily basis. It's important in terms of gut health, in terms of detoxification, in terms of blood sugar balance, and in terms of being able to limit inflammation. And that's really important. So the vagus nerve is in itself basically the 10th cranial nerve. So we have 12 pairs of cranial nerves that start in the cranial cavity in the head. And only one pair of those nerves will leave the head cavity, and that's the vagus nerve. And the vagus nerve actually extends from a little bit behind the ears and continues down through the neck. It sends a bunch of branches to different muscles in different areas. And then it goes down and it goes into the chest, sending a branch to the heart, sending a branch to the lungs, and then it goes down and into the gut and into the abdomen. And it sends nerves branching out to essentially every organ in our entire abdomen. Branches to our small intestine, large intestine, stomach, liver, gallbladder, pancreas, kidneys, spleen, you name it. Every single one of those organs has a branch of the vagus nerve that's telling it what to do, and that it's able to then send information back to the brain to do so. And so the vagus nerve is called the vagus nerve. It comes from the word vague, which literally means wandering. It literally means it just goes everywhere. It's all over the place. And so when anatomists were initially looking at this, they said, my goodness, this nerve literally is attaching to so many different organs. What do we call this? It's so vague. And so they called it the vagus nerve.
Isn't that crazy? And before we get into the functions and really the nitty gritty, how did you, with your background, get into really, being into writing a book and just getting so involved with the functions of the vagus nerve and how you can help people by improving by improving and optimizing the vagus nerve.
Certainly, great question. I am a chiropractor by profession. So when I went to chiropractic college, I was very interested in nervous system function, how the nerves and the brain function, how we actually send information from the brain to all of the muscles, to all of the organs, and back from those organs to the brain. And obviously there was a very strong connection to this specific nerve. And this nerve was taught to us as being the vagus nerve, and it sends parasympathetic information. We'll get into that later. But that it sends this parasympathetic information to all of these organs. And that was like, okay, cool. But why would it have such a broad and expansive attachment and innervation of all of these organs? What's so special about this nerve that isn't special about all of the other nerves? And as I continued on into functional medicine and learning how I could help my own health challenges that I was dealing with, I started to learn about all of the different organs that were affected, all of the different cells that were affected, and the fact that the gut was so important to optimizing my health. And so that's where the vagus nerve started to come up again as being this really important factor, and something that's overlooked so much, not only by conventional medical doctors, but even by functional doctors and therapists as well, because what we're often looking at is the symptom that we're seeing something is wrong in X organ or Y cells, but we're not talking about the communication between the brain and those organs and the brain and those cells. And so it slowly became this really important piece of the puzzle that I needed to share with everybody. And once I learned about all of the different exercises and tools, and I started working with my patients providing these exercises, we started getting really great results. And when these great results started occurring, I said, I got to get this information out to everybody. And that's what led me to write the book.
Oh, that's great. And that's why I had to have you on here so we can continue to share this really important information. So let's go into, so in terms of, to me, what it seems in terms of the bones, the digestion, the parasympathetic nervous system, all of these things, inflammation, all of these things have such a huge role in bone health, osteoporosis, as well as overall health. So why don't you go into the functions of the vagus nerve, what it's actually doing to some of these organs and how it's modulating inflammation. And why don't we just start that? Why don't we start with that, with inflammation as well, and the functions?
Absolutely. So inflammation is really important. Now, we know that inflammation is an important process in the body, and inflammation is actually a good thing when it occurs in short bursts when necessary. Under certain circumstances, inflammation is necessary in an acute situation. But oftentimes what happens is we don't have control on that system. We don't have brakes to put on and slow that system down. And so over a chronic timeline, these things can be very traumatic and cause major issues for a lot of people. So inflammation is good in short bursts, but we need to control that. And really where that control comes from is a system called the cholinergic anti-inflammatory system, which is mediated by the vagus nerve. So the vagus nerve uses a very specific neurotransmitter called acetylcholine, ACH for short. And acetylcholine, which is the same neurotransmitter that goes to the muscles to promote muscle function, we need to also look at it from, why does a vagus nerve have it if it's not sending as much information to muscles, it's sending more information to these organs? Well, this is where acetylcholine goes to actually work on specific areas in the spleen and in the gut. And it actually is going to cause the inflammatory cells in those organs to actually decrease their function. It actually is the brakes to the inflammatory system. And the reason why so many people are dealing with chronic inflammatory pain-based conditions, especially when it comes to bone health, is because they don't have the brakes working. They don't have that control of the inflammatory system working optimally. That's where we really need to put in that effort. And that's why the vagus nerve exercises are so strong, because when we can make that system work better, we can promote it, we can give it the right tools to ensure that we can put the brakes on the inflammation. That's when we're going to have positive changes and decreases in those inflammatory levels.
And do they know why? Like what would happen that causes this, that the vagus nerve is not acting properly?
Yeah, there's a lot of different reasons why the vagus nerve would not be working correctly, but the most common of them are we're not breathing correctly. We tend to breathe using our chest, and a lot of people have this major problem. So one of the tools that I have people do is actually putting one hand on their chest, one hand on their belly. I don't think you can see me there. But what we're doing is taking a deep breath, and we're checking to see which hand is moving. If that top hand is moving, expanding in and out with a deep breath, that means that you're breathing incorrectly. We should be breathing with our diaphragm, and we should be doing deep belly breathing from below. If you ever watch a baby breathe, for example, that's a really, really great way to see how we should be breathing. But what's happened over time is we've trained ourselves to say bellies are bad, that we need to have a tight, strong belly that doesn't expand and contract. And we've gotten ourselves into a situation where we're breathing with our chest using our accessory muscles. So that's why so many of my patients, both as a chiropractor and as a functional medicine doctor, have these really tight muscles across the upper back, upper chest. They have these really, really tight trapezius muscles and rhomboids and pec muscles, because they're all sitting in really slouch positions for the most part, and on top of that are using the wrong muscles to breathe. And so that's a sign that we're not using the vagus nerve correctly. We're not giving the right movement and the right information to the muscles that are showing that we're not under stress. And if we're breathing correctly, that means we're breathing with our diaphragm the majority of the time.
You're talking my language. I absolutely love what you're saying, because as a physical therapist, I've worked on deep abdominal breathing for so many years and teaching happiness and stress. It's so critical, but you are absolutely right. Most people, when you're saying, they're like, what do you mean? When I breathe in, my stomach goes in. So it's something that everyone listening see, because as it's interesting though that just, people think they're tight because their posture, that makes sense, or they're stressed, that makes sense. But I don't think most people correlate that because they're breathing from their chest, that can also tighten their muscles. And that's interesting that could be one of the main causes of a problem with the vagus nerve. So thank you so much. Okay, so you can continue, but I just had to chime in because I teach this and I love this, and it's just nice to see how important it is from so many levels. So thank you.
When we're breathing with our diaphragm, we're activating the vagus nerve, and that's really important. But there are other things that can trigger vagus nerve to not work correctly, to not be working optimally. So the next one that I like to look at is dietary factors. We want to make sure that we understand this, that the gut is the root of all inflammation in the body. And if we don't have a good diet, if we have an inflammatory diet, a diet that's full of processed foods, a diet that is full of high sugar, high fructose corn syrup, inflammatory fats, like really poor quality fats that we're cooking with, those things actually stimulate inflammation in the body. They actually cause the microbiome to react in a negative way. That's all the bacteria, parasites, viruses, yeast in the gut. And they're actually stimulating what's called an inflammatory cascade. So think of it this way. The more processed and crappy foods that we eat, more inflammatory foods we eat, the more we're pushing on the accelerator of inflammation. So think of it like a car. If we're pushing that accelerator, the brakes can only do so much of a job to slow that down. If we're continuously pushing the accelerator, the brakes are going to burn out. And that's what happens with the vagus nerve. The vagus nerve is the brakes. So what we need to do is decrease the number of inflammatory meals, cut down on all of that inflammatory dietary choices, because those are actually causing the accelerator to keep getting pushed and pushed and pushed and burning out the vagus nerve. Now, lucky for us, we actually have tools and exercises that we can use to re-bring up those brakes, to change the brake pads so that we have a little bit more to give. But if we're doing that continuously, we're actually causing these issues to get worse, and we're not allowing our vagus nerve to fight back and hold inflammation under control.
Wow, that's so interesting. And let's talk about the gut, because let's just get a little more into that, because for this population, people who are listening with bone issues, that is essential. And believe it or not, it's not something that's talked about that much. People know that if someone's anorexic, in childhood, that they're going to have deficiencies in their nutrients that can lead to bone loss. But it's not something that immediately, their diet, and people know that they do need enough calcium, that and vitamin D, but that's probably the extent of it for most people. They don't realize, how but let's talk in terms of the vagus nerve and the gut and how that can all be related.
Certainly. You mentioned a couple of really important nutrients there, calcium, vitamin D. The one I would add in as well would be magnesium. As a chiropractor, we know how important bone health and structural health is. And if people are dealing with bone health issues, they often don't think that it's going to lead back to the gut. But where do all of those specific nutrients come from? They actually come in through our gut. They come in from our diet. And it's really important to look at the gut function to optimize and really work towards getting your bones working really, really well. So the nutrients like the minerals, calcium and magnesium actually come in primarily through the large intestine from our foods. And if our foods are high in magnesium and high in calcium, then we're going to be able to get them in. But sometimes there's a bit of an issue, and that issue can be that the microbiome, those bacteria that are in the gut, are imbalanced. Now, why do I keep talking about this microbiome? Well, here's a fun little stat for you. In our human body, we have approximately 50 trillion cells, human cells. But in just our large intestine alone, we have over 100 trillion bacterial cells. What goes on in the gut affects every single cell in our body, including our bone cells, including our osteocytes, our osteoblasts, and our osteoclasts. Their ability to function is purely based on what's coming into the body and what's going on in the inflammatory cascade and what's going on in the microbiome and what's going on in the gut. So we need to make sure that that gut balance is optimized. If we have too much bad bacteria, they will steal these nutrients away from us. They require calcium and magnesium as well. And some of them really appreciate them and they steal it a little bit more. And that decreases the amount of calcium and magnesium and vitamin D that's bioavailable or available to our cells, our human cells. And that can lead to these health challenges, especially in regards to bone health when it comes to those nutrients.
Okay, great. So should we go right to what we can do to optimize this vagus nerve, or do you want to tell what you've seen in your practice when people add this piece to the vagus nerve? Either way, you can start with.
Yeah, one of the most common things that I see when people are coming in to talk to me is that they're dealing with like an autoimmune condition, something like a rheumatoid arthritis, for example, or osteoporosis is a very common example as well. And when people come to me with those issues, what I primarily and initially look at is what's going on with their diet. What's going on there with their dietary choices. Oftentimes there is some level of inflammatory diet that's included here. So we're talking about potentially people have sensitivities and allergies to gluten and dairy, for example. And we know when we're talking calcium, you're like, oh my goodness, milk, that's where I should be getting it from. But we now know that the amount of bioavailable calcium in milk is probably not very good. So we should be getting more calcium from deep leafy green vegetables. That's where we're going to get the most calcium from. So what I recommend to people is let's make some dietary changes first off. The first thing you can do, let's get those inflammatory foods out and boost up the level of those bioavailable nutrients and minerals that we get from vegetables. Mother Earth is going to give us all of those things. We should get it from there, not from the processed things like milk, unfortunately. And now we know with all of the added chemicals and all of the human growth hormone and stuff that's injected into our cows, that we are being exposed to all of those things. And that's affecting our inflammatory levels as well. It's really raising inflammation in our body. So it's very important to fix that and not have that affect us negatively. The next thing I do is I check to see how is digestion working and what is going on with the inflammatory cascade. So if we have high levels of inflammation, we know that the vagus nerve is not able to do its job. It's not being able to work at a very high level. And so we need to add in some exercises to help promote that. And that's where we have to look at what does the vagus nerve actually innervate and how can we affect it. So like I said, we have this nerve that comes from behind the ears. It actually sends a branch to a part of the ear for sensation of the skin. It sends a couple of branches to the muscles of the back of the throat and to the vocal cords. And that's really important. The muscles around the vocal cords are actually innervated by the vagus nerve, and they're actually causing pitch in our voice. So oftentimes you'll notice somebody that has decreased vagus nerve function actually has a monotonous voice. They aren't able to raise pitch in their voice as well. So they're very, very bland and talking in a very monotonous voice like so. Where we really want to have the ability to go up and down in our pitch, and that is a sign that we're getting good signaling to those muscles.
That's so interesting.
Yeah, it's a very important kind of piece of the puzzle. So when I'm listening to my patients speak, I'm not listening to what they're saying, and I'm not just listening to what they're saying, I'm listening to how they're saying it as well and how they sound when they're talking. So it's very important to keep that in mind. And if you hear somebody with a very monotonous voice, oftentimes there's a link to that and other health challenges that they're having. And then once it goes down into the chest, it sends a branch to the heart. The heart is really important. What the vagus nerve does to the heart is it actually decreases the heart rate, and it actually slows down the way that we're pumping blood, and it allows us to do so in a relaxed and recovery-based state. So if our heart rate is high, if our heart rate is anything over 80 beats per minute, then we know that our sympathetic nervous system is working too strong and our vagus nerve is a little bit weaker. And we're not able to actually get that heart rate down. What's an even better function is the actual heart rate variability, which is a whole nother thing. We don't need to get into that in complete depth, but heart rate variability is a sign of the number of milliseconds between each beat over a period of time averaged out. And the higher the variability, the more the range, the better it is. And so I track that personally using my Oura Ring, which I'm wearing here. There's a lot of other tools you can use. There's the Elite HRV tool. There is tools like HeartMath, which are great for attaching to the ear and going into a moment of calm and relax and being able to see if your heart rate variability is strong. Heart rate variability is the best way to see if your vagus nerve is working correctly or not. And so this is one of the best tools. If you want to learn more about that, you can check out the website healthupgraded.com, and there's a lot of articles and tools that you can talk about in there.
Can I just say one thing? I love this, and I think I'm big into the Institute of Heart Math that's done so much research on heart rate variability, and this is very powerful. And it's great that we have the ability to really evaluate it using heart rate variability. So I think
heart rate variability is that direct sign of vagus nerve function. So I love that you're doing HeartMath, and that's something that most people that are having inflammatory issues should be doing. It's a very inexpensive tool. It's absolutely worth the investment in being able to look into what's going on with heart rate variability, breath rate, and being able to go into a state of coherence when possible. And so I'm all for it. If people are really interested in that, they should speak to you about that for sure.
It's not even that. I just like the Institute of Heart Math and their practices. It's not that I actually use the device. It's more that I teach some of their practices and meditations that they found that works, getting people into heart rhythm coherence. So I think that's just terrific. You want to just take 2 seconds to talk about how you use the Oura Ring? Because
absolutely.
And the good thing about the EMFs in the Oura Ring, because it's quite interesting.
I love my Oura Ring. It is probably the simplest tool to use to track heart rate variability, because it actually is able to average your heart rate variability over the entirety of the night. So it actually tracks your sleep. It tracks if you're awake, if you're asleep. It tracks when you go to bed, when you wake up. It's a sleep tracker. But on top of that, it's actually able to measure heart rate variability over 7 to 8 hours if you're sleeping that long. And what that does is it actually gives you a measure of your ability to recover over the night. It's also a really great tool to be able to set a moment and sit and actually see what your HRV is over a 3-minute period in the middle of the day, which is great as well. But I use it to see how things are going in my body, and if I'm able to recover from the stressors of the day. It's an awesome, awesome tool. I would recommend it to absolutely everybody if you can afford it. Yeah.
Wow, that's just great, because do you see that many of your patients just don't know? They don't know they have this issue. So people listening may think they're relaxed, they meditate, they do things, but yet they are having issues with their heart rate variability?
Yeah, I've had people come back having checked their heart rate variability with their Oura Ring the first time, and their readiness scores and their HRV is sitting around 20 milliseconds, 25 milliseconds. That is not good. We should be closer to 70, 80, 90 milliseconds where that's actually telling us that there is a higher level of variability and that our vagus nerve is actually pumping and sending information at a higher rate and working really well. If we have low HRV, that means we have low ability to recover from stress. And the vagus nerve is really important in that recovery period and the ability to handle not just major stressful life events, but the daily stressors that we get on a daily basis. So our ability to recover is absolutely key, and this is a great way to track that. And I think you mentioned that the EMF idea, that we don't want to be exposed to high levels of EMF. This ring actually is one of the coolest things. You can actually put it on airplane mode. So it has 0 EMFs while it's on airplane mode. And when you put it onto the charger itself, it'll actually start back up. And it's just a Bluetooth thing, so you can actually track it on your phone. And you don't need to be tracking it constantly. It's constantly recording information, but it's not actively sending out EMFs into your body. And so it's a great wearable device. It's not like an Apple Watch that's constantly going and sending out these EMF waves into your body.
Oh, that's great. That's just really, really wonderful. So, okay, so I interrupted you. We were talking, I think we were at the part of optimizing. You can continue where you were, optimizing vagus function.
So we were at the heart, and then the next part is the lungs. So we actually send our next branch to the lungs, and that's actually going to track to see if our breath rate is really high or low. So think of it this way. When we get stressed, and the really easy way to look at this is if we start getting chased by a pit bull, for example, our heart rate is going to go up. We need to get away from the risk to our survival. We need to get away from the threat. And so we have 2 options. We can either fight or we can run away, flight. Okay. And we go into a system called the sympathetic nervous system, which is the fight or flight system. What ends up happening when that occurs is our vagus nerve turns off and our sympathetic nerves turn on. What that does is it shuts off blood flow to our entire abdomen. It does not send blood flow to those organs because at that moment, digestion and detoxification don't matter. What matters right now is getting blood flow to the arms and to the legs to say, I need to fight and I need to get away from this thing. And that's where the fight or flight system works. And so what happens when that occurs is our breathing becomes very shallow. It becomes very chest-based. Then we start to breathe with those same accessory breath muscles, and we breathe really, really quickly. Quick, shallow breaths to get quick oxygen into the body as quickly as possible so that we can run away. The problem with that is oftentimes we go into that state just by breathing shallow and causing ourselves into that fight or flight state by telling ourselves through our breath where we're at. And so that's why deep belly breathing is so effective and so important. So when we go into the parasympathetic rest, digest, recovery state where the vagus nerve is active, we have a slow, deep belly breathing that's working really, really well. And that's a sign that the vagus nerve is working correctly. So what it's doing is it's actually tracking lung function rather than telling the lungs what to do. We can actually consciously tell the lungs to be in a calm state and train ourselves to stay in that state as much as possible. And yes, stressors will come up. Boss will call you into the office. Kids will scream from down the hall. All of these things are going to happen that get us into a little bit more of a state. But if we can train ourselves to go back to calm and use our deep belly breathing as a major tool, we can turn on the parasympathetic nervous system again. So that's really cool.
And the nice thing is that this is something we all have. We all have our breath, and it's easy. I love easy tweaks that can have just amazing, amazing results on our body and on the vagus nerve. This is fabulous.
One of my amazing colleagues, Dr. Jared Sigler, who I worked with previously, had a really great quote. He said, our breath is our one window into the autonomic nervous system, into making sure that our vagus nerve, our sympathetic and parasympathetic nervous system is working really well. And if we can control our breath and really learn to breathe correctly, we can have complete control of how our body responds to stress. For a lot of people out there, you probably haven't heard of a gentleman by the name of Wim Hof. But Wim Hof is one of the coolest guys on the face of the planet. He can control his breath. He can control his stress to the point where he has hiked up Mount Everest in nothing but a pair of shorts and boots. He goes out into the cold, into the ice, without a t-shirt, without any, like with shorts, and he's able to control how his body responds. He's been injected with lipopolysaccharide, which is bacterial endotoxin, which should have killed him. And he was able to control his inflammation level using simply his breath, because he's trained himself to do such things. So if you're really interested in learning about how you can use your breath and how you can train your body to react to inflammation and to control the inflammation in a very optimal way, I highly recommend looking him up. The gentleman's name is Wim Hof, WIMHOF, and his method is called the Wim Hof method. And he's got some free courses online, some really awesome tools that anybody can use, a lot of great podcasts and YouTube videos with a bunch of really great people. And he teaches you how to control your breath, how to control your system, and how to just really reduce inflammation levels. So that's a really, really awesome tool for anybody to be able to use.
Wow. Well, talk about awesome tools. I love your book. I just think it's so wonderful, and it's easy. What I like about the book is you do a great job of taking complex material and simplifying it so it makes sense. But you also give lots and lots of wonderful tools. So can you share a few with us, other things? We have the breath that people can use to optimize this vagus nerve, because some of them are really interesting that I would never have thought, oh, wow, who would think of that? So yes.
So in order to understand them, we have to go back to where those nerves go to. So the first one, I remember saying that the nerves go to the back of the throat and to the vocal cords. And so one of the best tools that we can use is actually gargling. Gargling is one of the coolest things because it's actually going to stimulate a few different branches of vagus nerve. So what gargling does, when we take a sip of water, I'll have my patients keep a glass beside their sink, and every time they brush their teeth, you're going to gargle 2-3 times to help promote this. And so what you do is you put a little bit of warm water in a glass. You can throw a little bit of salt in there as well, which is great for breaking up some of the bacterial plaque at the back of the throat. And you're going to take that sip and you're going to let it go down. You're going to gargle as hard as you can in your throat. What that does is it allows you to stimulate the throat muscles at the back of the throat, because we need the airway to continue to stay open. We need the epiglottis to stay closed so that we don't accidentally pull water into the lungs. Okay. And at the same time, we're stimulating the muscles around the vocal cord. So if we're going and we're gargling and we're going as hard as we can, what that's doing is it's stimulating 3 different branches of the vagus nerve, which is really, really great, because all at the same time, we're really giving it a good workout. And so when we do that over and over, continuously, consistently, we can really promote optimal health. So gargling is one of those amazing tools. You know it's working if you are actually starting to tear from your eyes. That's a sign that you're doing it correctly and that you're stimulating enough inside your brainstem to optimize this function, to really get it up and running.
Quick question. Does it matter what kind of salt you use when you're doing that?
I'm not picky about this. It can be table salt, Himalayan pink, doesn't really matter. Whatever your preference is. I know my personal preference is Himalayan pink. I do prefer that personally.
Okay, great. Wow, that's fantastic. How easy. Gargling. That's what I'm saying. These things, to improve your health, who would think that gargling can affect every organ in your body with the vagus nerve? It makes sense. Maybe it helps your throat, but it's just so interesting.
Absolutely. Another really great tool, and it's linked to gargling, is one that you can use with kids even. And this is a great one that I've used with my daughter quite a bit. So right before a meal, I really like to get us into a very calm state. We'll say a prayer before we eat. And sometimes, especially when we're a little bit more riled up, we're a little bit more excited, especially if she's had like a play date and things are really excessive. What we do is we actually do some humming for about 30 seconds prior to our meal. So humming using our muscles in our throat. And the first time we did this, my daughter looked at me like, what are you doing? But now she loves doing it. It's one of those really awesome tools that we can use to get her calmed down. So we don't hum when we're stressed. We'll hum or sing or chant when we're calm, when we're relaxed. And we're using those same muscles that vagus nerve is innervating by doing these things. And it's actually been proven in a lot of research, I talk about it in the book, that there's a lot of research showing when we stimulate those muscles, we're actively causing heart rate variability to go up. and actively contributing to vagus nerve function improving. So humming for 30 seconds prior to your meal, doing some deep breathing exercises are great tools to use to help get you into that parasympathetic state where your body is actually able to digest better, and you're stimulating that digestive system, because now we have signals going through the vagus nerve, not only to that muscle, but also going to all of the organs below, so that our digestive process and our gut can actually start working correctly as well.
Wow. I personally do deep breathing and teach that before I eat, but never adding the humming. That's amazing.
Yeah,
That's
it's a wonderful
any kind of hum? Does it
Any
matter?
kind of hum doesn't matter at all. Anything that calms you down, nothing that'll rile you up, but something that will keep you calm. And each person's going to have a little bit different tool there, but that's a really great one.
Oh, that's fabulous. Thank you so much.
No
Oh,
problem.
great. Any other quickies? And then
Yeah, I've got a couple more. Sleeping on your side is better for your vagus nerve than on your back or on your front.
it's interesting. I read that in your book, and I sleep on my back, and I'm thinking, oh, I don't know if I can change that one.
That
But
might be a difficult one. But
that's and how did they find that? That's sleeping.
They actually tested heart rate variability of people sleeping in all different positions, and they noticed actually the left side was better than the right side as well, but very, very minimally. The side sleepers tended to have less vagus nerve, or more vagus nerve function than HRV numbers than the back or tummy sleepers.
Wow, that's
Yeah.
great.
And listening to music as well was a really simple one, which literally involves you turning on music and not having to worry about it. But there were certain pieces, certain composers that worked a little better. And there's a particular one that actually worked the absolute best, a specific composition by Mozart called K448, Two Pianos. I actually, when I initially started researching and found this, I was like, really? This is like, did they research this? And I actually started listening to it on YouTube while I was writing the book. And when I started doing that, the book started coming faster. It was really interesting how like really stimulated that creative process. It really stimulated my ability to just be in that calm state. So look it up on YouTube, Mozart K448, Two Pianos. Wonderful
Wow.
music. It's 24 minutes long. It's amazing. It really just sets you through some emotions, but that one in particular has been shown to increase heart rate variability. So there's lots of really cool little quirks and tools and tips and tricks that I include not only in this episode with you, but also in the book. I have about 25 different exercises. Massage therapy, acupuncture can be very beneficial, visceral manipulation. There's a lot of these great tools that I talk about how to ensure that you can optimize the function of your entire body, decrease inflammation, and make sure that your body is really functioning at a high level.
You know what I love, Navaz, is that these things are pampering also.
Yes,
so it's
absolutely.
not like, oh, I have to do this. It's like, oh, I have to do this for my vagus nerve, get a massage. Yeah. Or I have to, they're really good things to do. So it's like a win-win, and you're helping yourself and you're helping your bones in every aspect of your body.
Exactly.
So that's what's so great. I know we could talk for hours because there's so much great information, but you also are giving our listeners something that also can help jumpstart their vagus nerve. Can you just tell us about that? And I'll have the link in the show notes as well. But
for sure. So if you don't want to get into all of the science and really understanding why the vagus nerve works incorrectly, if you just want to get to the exercises and know what the top 10 exercises that I recommend are, I have a free e-guide that you can download for absolutely free. I believe we'll put the link into the show notes, but it's on my website, healthupgraded.com. And you can absolutely look that up and download that. And it's a simple, easy read, 10 easy exercises that anybody can do, including some of the ones we talked about today. And it'll really explain how you can really work towards optimal vagus nerve function.
And so I have a question. So with your patients, you're working on all these different things, or people are going to start doing them. How soon should they check their heart rate variability? Like, when do you see that there's a difference?
I like to track right from the beginning onwards and actually see how these things go, because when we stop doing them, heart rate variability actually returns back to where it initially started. So I'm a fan of tracking as continuously as possible. Each one of these tools, the Oura Ring, the Elite HRV, Heart Math, will all track momentum, like in the moment. They're not actually going to track over a long period of time. So we don't want to see at some point, like it's not like a test that you need to do 6 months out. It's something that we need to track on a daily basis where possible.
And anything else, if they choose not to purchase things, that people will they feel calmer, or what will people start noticing that they can?
Oftentimes the biggest things I hear are better digestion, making sure that there's an increased regularity when they're going to the bathroom, a lot more calmness, and just feeling like they're able to put their brain function forward. When we are in a calm state, we send more blood flow to our prefrontal cortex, and we have better executive decision making, and we have better decision making, less brain fog, a lot more clarity of thought, a lot more balancing of mood. We have decreased inflammation throughout our entire body. There's just so many different things that I hear, depending on each person, what they notice. But the biggest things are going to be that digestion and clarity of thought, and ability to make decisions more quickly, more readily, and more effectively as well.
Oh, that's great, because all these things, stress has such a negative effect on our bones as well as every area of our body. But we can't measure our bone health right away. So it's nice to have other things that we can sort of, because it's nice to get feedback that things are helping. And this has just been, anything else you want to say to the audience before we end?
I think we've covered quite a bit, and I don't want to overload anybody with a bunch of more information. But if you're ever interested in learning more about this, if you ever really want to look deeper into your overall health, beyond bone health, beyond gut health, and trying to figure out why the challenges are happening, functional medicine is a great tool. My book goes deeper into each of those subjects. You can read a lot more about that, and I'm happy to share with anybody who's interested. I love being able to talk about this. As you can see, I'm very passionate about it.
Well, it's really great. It's really great that you found this area that's not talked about, that there's some easy tweaks we can do, and people can, because I think everybody wants to do whatever they can to help their health, but if they don't know about something, then how can you affect that? So I think to even just realize that this vagus nerve can affect so many different functions, that can, with the inflammation in the gut and the stress, every single area that we talked about can affect so much, but yet we can deal with it. It is great. And I love the book. As I said before, I just think you did a great job. So kudos to you that you're bringing this out to the world. I mean, I think, and that's sort of why I have the podcast, because I want to get this information out to people because it can help, and it's really powerful. So I'll have the link for the book as well in the show notes. And yeah, well, this has just been so much fun. I have some things that I'm going to do now right away after this. And so, yes, I don't know about sleeping on my side, but there's a couple other things, and there's other things in the book that are good as well. So,
Absolutely.
So thank you so much for taking the time. It's been a pleasure, and look forward to staying in touch.
Absolutely. Thank you so much for having me, and I really appreciate it.
Okay, bye-bye. I hope you've enjoyed today's interview with Dr. Habib as much as I have, and now have some great tools for activating your vagus nerve. All the links will be in the show notes, including the link to his book, as well as his special gift. So goodbye for now, and I look forward to seeing you on the next episode. Thank you for listening to this episode of the Happy Bones, Happy Life podcast. If you enjoyed this show, please subscribe on your favorite listening app so that you don't miss any amazing insights on upcoming episodes. And until next time, continue to live your best life ever. See you soon.